Welcome to all my dears. Today we are going to discuss about liver function test. Being the largest gland in our body, liver performs near about more than 600 biochemical functions in our body every day, very silently, because we don't know that our liver performs that much number of functions on every day or every minute or every second. At the same time, somebody may knows about the synthesis of bile, enzymes, blood coagulation factors, etc. solely. Out of 600 functions, liver removes potentially toxic byproducts of certain pharmacological or pharmaceutical products or some other medications. It prevents the shortage of nutrients, especially by storing the vitamins, enzymes, minerals, etc. Liver metabolize or break down the nutrients from various type of food to produce energy as and when required. Liver produces most needed proteins in our body and it helps us to fight against infection. More than that, liver produce the main coagulation factors, helps to synthesis of various hormones by absorption of vitamin A, D, E, K, etc. are mainly done by the liver. Due to various reasons, our liver may get infected by microbes or because of our lifestyle issues or habit of alcoholism or smoking or various drugs or due to genetic or autoimmune problems. Like that, so many reasons our liver may get affected. At the same time, even in advanced pathology, we may not get the characteristic symptoms of liver disorders. So, in such suspected or a doubtful situation of our patient, it's only our duty to evaluate the efficacy or efficiency of our status of our liver. For that, we may force to or we may advise our patient to get to do some clinical investigations, especially hematological investigations. Such evaluation, analysis, and interpretation of observed hematological values are clinically correlate with our patients. So, in such condition, some important biochemical parameters may give some clue to our invigilation, and such parameters are collectively known as liver function test. Let us see which are the main liver function test. First of all, let us study the synthetic function of our liver. One of the main function of our liver is to synthesize the bile. Anything which alter the synthesis and secretion of bile, that will result in abnormal bile value or a bilirubin value in our blood. And interpreting the values, we can assume that what may be the possible cause behind the status of such abnormal bilirubin level in our blood. In a healthy person, the normal serum bilirubin value ranging from zero point 0.2 to 1.2 milligram percentage. On evaluating the total bilirubin value, you can see the value of direct bilirubin, that is conjugated bilirubin. It can be up to 0.2 to 0.4 milligram percentage, and of indirect bilirubin, that is unconjugated bilirubin, it can be up to 0.6 milligram percentage. So the normal bilirubin, serum bilirubin value is 0.2 to 1.2 milligram percentage. The total direct bilirubin, it can be up to 0.4 milligram percentage, and the indirect bilirubin or unconjugated bilirubin, it can be up to 6 milligram percentage. If the observed value is that means your patient is not jaundice, he is very healthy regarding the synthesis and secretion of bile. But the serum bilirubin value can be raised due to various reasons. Let us see which are the main common causes of jaundice. The common causes of jaundice can be usually due to some blood dyscrasias like hemolysis. Unfortunately, the same can be usually due to snake poisoning, or due to dengue fever, or due to leptospirae. These are the common clinical conditions that can be seen due to hemolytic causes of jaundice. Other causes of jaundice are mainly due to hepatitis. Then, as the pathology advances, the same jaundice can be also due to cirrhosis or liver tumors or cholangitis or Epstein-Barr viral infection or cytomegaloviral infections. In some of our patients, you can see the bilirubin value are persistently elevated. At the same time, it may not cause any damage to our patient. Usually, such type of clinical jaundices are considered as autoimmune or because of the genetic disorders like Gilbert's disease, etc. That can be studied in another class. So these are the common causes of jaundice. So it may be due to hemolysis, or it may be due to infection, or it can be due to chronic liver disease like cirrhosis of liver, or scarring of liver, or fibrosis, or hepatocellular carcinoma, or maybe due to various viral infections other than hepatitis A, B, C, D, E, or it can be due to EBV or cytomegaloviral infections, or the same jaundice may be because of any liver tumors, or due to any infections by gallbladder. So these are the common causes of jaundice. On evaluating our patient with jaundice, we can see there is elevated level of direct bilirubin. That means you can see along with the elevation of total bilirubin, the direct bilirubin seems to be elevated. Let us see what may be the cause. Usually, the increased direct bilirubin is seen in obstructive type of jaundice. That means extrahepatic causes. There may be obstruction in the right or left bile ducts, or the obstruction may be due to any cystic duct, or it can be due to any infection of gallbladder, or the same can be due to viral infections or a viral hepatitis, or the direct elevated bilirubin may be because of alcoholic hepatitis, or conditions like sarcoidosis, or in patients with primary biliary cirrhosis, that means very sclerotic changes in the biliary canaliculae, or in conditions like primary sclerosing cholangitis. These are the main causes of elevated direct bilirubin in a patient with jaundice. It can also be due to extrahepatic conditions like cholelithiasis, or pancreatitis, or cytomegaloviral infections, or it can also be due to cancer of gallbladder, or cancer of pancreas, or lymphomas. So because of various pathology, the direct bilirubin can be elevated in a patient with jaundice. Let us see. On examination of bile, especially with indirect bilirubin or unconjugated bilirubin, there may be elevated indirect bilirubin can be seen in, especially with hemolytic anemias, or due to some blood dyscrasiasis. As we mentioned earlier, the hemolysis or destruction and liberation of the RBC, it can be due to snake poisons or due to dengue infections or due to leptospiral infections. That means hematological causes are the main cause of indirect bilirubin. But at the same time, it can be due to hepatitis or cirrhosis also, or CA also, then hepatic congestion, and at the same time, due to some autoimmune disorders like Gilbert's disease or a genetic disorder. That is what I mean. Gilbert's disease or Crigler-Najjar syndrome. So the formed bilirubin may fail to be trapped by the liver. There is increased production of bilirubin is there due to uncontrolled destruction of the RBC or hemoglobin, and the degradation of the hemoglobin, as we know, that results in production of bilirubin and biliverdin, but our liver may fail to trap the formed bilirubin up to that quantity. So in such condition, the jaundice is not because of any defect in the liver, it is only because of the defective blood dyscrasiasis. So that may be the most common cause of elevated indirect bilirubin in a patient with a jaundice. At the same time, the indirect bilirubin along with the total elevated bilirubin can be seen due to genetic disorders like Gilbert's disease and Crigler-Najjar syndrome. Okay. Next, I want to say about the cases of neonatal jaundice. In cases of neonatal jaundice, you can see there is elevated direct bilirubin. Let us see what may be the cause. In neonatal jaundice with elevated direct bilirubin, it is mainly due to sepsis of. It can also be due to intrauterine viral infections or due to neonatal hepatitis. It can also be due to intra or extra hepatitis or hepatobiliary atresia or biliary tract obstructions, chromosomal defect, that is trisomy 18, and in conditions like alpha-1 antitrypsin deficiency or cystic fibrosis, hypopituitarism and hypothyroidism. So many endocrinal disorders can lead to increased or elevated level of direct bilirubin, and at the same time the main cause of elevated direct bilirubin is due to sepsis of neonates. That may be due to intrauterine or before delivery or after delivery. These are the main causes of increased direct bilirubin in neonates. Next to the serum bilirubin level, let us study and evaluate the synthetic function of our liver with proteins. As you know, one of the main source of production of protein in our body is done by our liver. So on evaluating the serum protein value, a normal healthy person is supposed to have 6.5 to 8.5 milligram percentage of normal serum protein levels. Of that total protein value, serum albumin is supposed to be 3.5 to 5.5 milligram percentage. With the globulin value, it is just 50% of the, usually it is somewhat 50% of the serum albumin value, that is 1.5 to 3.5. If so, the albumin globulin ratio is 2:1. So the total protein value in a healthy person, that is 6.5 to 8.5 of albumin, that is 3.5 to 5.5, and globulin 1.5 to 3.5, and albumin globulin ratio is 2:1. As and when our liver is getting diseased, automatically synthesis of protein may get altered, or our liver may fail to synthesize the protein in sufficient quantity. That is what we call it as a condition of hypoproteinemia. Keep in mind, at the same time, you can see hypoproteinemia other than liver problem like in patient with chronic kidney disease, because in CKD the liver may synthesize the required amount of proteins, but unfortunately the kidneys may fail to hold the same, and the same protein may leak via urine. So even though our liver may synthesize that much amount of protein, the same way excrete via urine. That condition also leads to a condition of hyperproteinemia. Okay, let us focus our study over the functions of our synthesis of protein with liver disease. In liver disease, usually you can see a low protein value. Of that low protein value, the synthesis of albumin is severely affected in hepatic patients. At the same time, you can see a false elevated level of albumin in patient with severe dehydration or after having albumin infusion. But in diseased person, usually the albumin level will be lower than 3.5. As the albumin may get a deficient, you know that the synthesis of globulin is usually done by extrahepatic pathways, so that globulin level will be usually higher than albumin. Automatically that will lead to reverse albumin globulin ratio. In a healthy person, the albumin globulin ratio is 2:1. In a diseased or in a hepatic diseased person, automatically the albumin globulin ratio will be 1.1:2 or 1.4:, something like that, or 1:2, something like that. That means a reversal of the ratio of albumin and globulin can be seen in CLD or chronic liver disease patients. Let us specifically study which are the conditions that may lead to a low serum albumin levels. The low serum albumin level is mainly seen in patients with a cirrhosis of liver or in patient with a nephrotic syndrome. If patient with a very poor nutrition or a rapid intravenous hydration or inflammatory in patients with inflammatory bowel disorders, or after having severe burns, or in patients with neoplasia, or patient with chronic infective or inflammatory disorders, or persons with abuse of contraceptive, and more than that, prolonged immobility, that can also lead to a low serum albumin level. But here we have to focus over the hepatic issues. So it is mainly seen in cirrhosis or CA, or it can also be seen in patient with renal problems or nephrotic syndrome or hepatorenal syndromes, or in patient with autoimmune disorders like inflammatory bowel disorders, so or after having severe burns, etc. So in such condition the albumin level may be low.